Hi everybody, welcome to Vitalab video. We would just like to wish the Endo Warriors all the best for their walk on Saturday. This walk is being held at the Red Flag Farm Zoo. We will post the details of where it is. It is a free walk in support of women who suffer from endometriosis. The walk is this Saturday on the 19th of March at 12 o'clock. Bring your family along and come and enjoy the 2.5 kilometer walk with us. It's a beautiful place, it's out in the open, and it's really something to do on a weekend, in order to just get a little out of Johannesburg. I'd like to use this opportunity to bring to the attention of patients out there who have endometriosis. Firstly, we need to know that endometriosis is not always the reason why couples don't fall pregnant. Our unit treats women that have endometriosis but are having difficulty falling pregnant. So we don't necessarily treat the endometriosis, because probably the one and only best way of treating endometriosis is to achieve a pregnancy. And all our medical management is regarded as very similar to creating a pseudo-pregnancy state. So we give patients medication that puts them almost into a pregnancy-like state to keep the endometriosis quiet. As we know, a lot of these women unfortunately have been abused and have had numerous laparoscopies. It is very important to understand that you cannot laparoscope endometriosis away, and you cannot laparoscope a patient into a pregnancy state. So numerous laparoscopies by doctors for endometriosis is not on. You need to go and get a second opinion, especially if you are having difficulty falling pregnant. You need to go to a unit like ourselves or other fertility units that are in South Africa. The next important issue that one must understand is there seems to be a coexistence between endometriosis in a female, where the female herself has a reduced number of eggs and a reduced normality of eggs, and there seems to be a coexistence here, and it's very hard to say what comes first, the chicken or the egg. We think it is probably women with a reduced potential related to egg function and quality seem to coexist more so with endometriosis, and not the endometriosis causing the problem. The big issue that we see is these women that continuously have numerous laparoscopies, and especially when they use an argon beam laser to burn the endometriosis. That's almost like using a flamethrower in your abdomen to burn the endometriosis. We find that this surgery ultimately ends up destroying the ovaries and also ends up destroying the anatomy of the pelvis. These patients develop severe adhesions and end up needing in vitro fertilization in any way. The final thing of note is that endometriosis comes in 4 different stages. And if you have stage 3 or 4 and the doctor has done a laparoscopy on you and given you that staging, the next treatment of choice to achieve a pregnancy is only IVF. By waiting 6 months or 9 months or a year is not going to get you pregnant. So stage 3 and 4, which is moderate and severe disease, you require assisted reproductive technology to continue and establish a pregnancy. If it's stage 1 or 2 disease, there may be a slight improvement in your natural potential to achieve a conception, but this happens usually within the first 4 to 6 months. And if you have not fallen pregnant after the first laparoscopy for stage 1 or 2 disease, do not go and have another laparoscopy, because you will still not fall pregnant. It is then obvious that the endometriosis is not the reason for why you are not falling pregnant. So therefore, seek help from a unit like Vitalab or from another fertility unit that understands the problem, and there are a few units in South Africa that can help you. Thank you.